name is Ray, psychiatric mental health nurse practitioner. If you like the content today, hit the like button and subscribe. You can also hit the notification bell to know each week when I post a new video. So today we're going to be talking about tardive dyskinesia. So tardive dyskinesia is caused by certain antipsychotics that block the action of dopamine in the brain. Specifically, the mesolimbic pathway that can lead to psychosis. So antipsychotics is usually prescribed to individuals who are suffering from schizophrenia. So these medications block the dopamine chemical within the brain. But what happens is the medications can cause an excessive dopamine surge inside the neurons in the brain. And this excessiveness can cause tardive dyskinesia, or TD for short. So tardive dyskinesia is caused by long-term use of certain antipsychotic that, again, we just explained is used to treat schizophrenia. You notice certain symptoms such as lip smacking, eye rolling, tongue protrusion, arms and twisting of the body. Other things that can be noticed in TD is lip smacking, also chewing excessively. This can sometimes sound like grinding of the teeth. But these are some of the signs and symptoms that you can see with people with TD, or tardive dyskinesia. Okay, so like I said before, a lot of there's some medications or antipsychotics that are usually causing the TD, right? So with TD, the type of medications that cause that is typical agents or typical medications. Some examples of these typical medications would be THORAZINE, PROLIXIN, HALDOL, LOXITANE, STELAZINE, and MOBAN. TD can occur in people who are being treated for more than 1 year with typical antipsychotics. So most of the viewers are probably saying, man, what do I do when I see something like this? Well, see, sometimes TD is seen as someone on drugs. Sometimes they may say, hey, that patient, if it's an older patient, hey, that patient is just have some dementia. But you have to pay real close attention to these things, such as the symptoms that I told you earlier. So treatment for TD or tardive dyskinesia would be to discontinue the typical medications and starting an atypical medication. You probably say, what is that atypical medication? So atypical medications are such as RISPERDAL, SEROQUEL, GEODON, ZYPREXA, CLOZARIL, ABILIFY, and INVEGA. Those are just a few examples. And some of you mental health workers, such as mental health nurses and nurse practitioners, this is valuable information, especially when you're treating someone with schizophrenia. So some preventative measures you can take when you prescribe typical medications would be medications such as Cogentin or Benadryl. Some of these medications can assist in preventing these types of symptoms. But again, long-term use past a year can sometimes result in tardive dyskinesia. And you may also have to, again, swap out the medication for an atypical medication. Let's give some risk factors of getting tardive dyskinesia, right? So risk factors: older or elderly patients, the female gender, presence of mood and cognitive disorders, also long-term use of typical antipsychotics. Okay, I hope you guys enjoyed the video. This information that I'm providing is not just for the mental health workers, but also it's to inform family members who may have a person in their family that may be suffering from schizophrenia. Okay, if you have family members as well as psychiatric mental health nurse practitioners or mental health nurses, always be aware of these types of symptoms with clients that's suffering from schizophrenia. The way to test and make sure that we're on top of our game when it comes to caring for these individuals is providing what they call an AIMS test. It stands for Abnormal Involuntary Movement Scale. So if you're a family member and you're taking your family member to a office, make sure that they're taking accountability as far as checking their movements. Also in the inpatient setting for the mental health providers, also use an AIMS test in the inpatient setting. I hope this information that I provided today was useful to everyone. And don't forget, if you like the content, click the like button and subscribe. And also, click on the notification bell.